Is it actually possible to safely get a larger penis? Penis enlargement is a phenomenally misunderstood subject. And so today I have brought an actual expert on it. Everyone, please meet Doc Hink. Thank you so much for coming on to my channel. Could you just quickly introduce yourself?
I go by the name of Doc Hink. So believe it or not, I'm actually a real medical doctor. This mask has kind of become my gimmick. I also use it to kind of protect my anonymity because I talk about spicy topics like penis enlargement, and I also run a clinic. I personally don't like to call myself an expert just because I like to present data and I want you to not just take my word for it, but to actually see the published literature and say, okay, yeah, this guy knows what he's talking about. I'm honored to be here. It's truly a pleasure.
I'm glad that you're here. And I did check the literature that you created. I checked the study that you ran.
Yeah, the Hink trial.
And your other YouTube videos. And I was really impressed because I totally think that there's a very legitimate need for anonymity if we're going to have like real conversations about subjects that make people uncomfortable, about subjects that maybe are not well understood. I mean, I totally get it. The reason that I'm really excited to have you here is like, I've been studying penis enlargement. I've had several clients that were interested in it, but not having the equipment myself has always felt like this is something I can share a lot of information on, something that like I can do research on as a former researcher. I know how to check these things, but I also wanted to speak to someone who not only has personal experience, but also has helped other people, like guided them through this process.
Yeah.
First off, is it possible to safely enlarge your penis?
So yeah, absolutely it is. And there is actually a lot of published literature that more than people think of, actually sometimes even randomized trials looking at using, for example, a penile extender for people with small penis syndrome where they just feel like they have a small penis, in addition to studies like Peyronie's disease that actually show that there is significant enlargement. I actually published my Hink trial where I showed that guys on average gained a 1/2 inch in length and a 1/4 inch in girth in 6 months with actual photo documentation that you can see for yourself, rather than some of these studies that just say, oh yeah, trust me, bro, no, they gained this much. But yes, it's absolutely possible. And I've put on considerable size myself. I mean, I put on over 1.5 inches in length and over 1 inch in girth over
in the 6 years that you've been doing this?
Yeah, 5 years, but 3 of those being actually very active. But yeah, it's so yeah, it works. It is possible, but you do have to do it safely.
Yeah. Will you tell me what the major risks are? Like what are the most common injuries?
Yeah.
Like what kind of things do you tell guys to look out for? Like do guys come to you after having hurt themselves because they want, to get more information on what they can do to heal?
Yeah, so actually both. So the number one thing that I tell people that are interested in like my coaching for how to get bigger is it worth it to you to potentially have a bigger penis that doesn't work? Because you can do it safely, but it is not risk-free. And I have had some guys through doing, poor techniques that have caused really permanent injury, and even to the point of getting an implant, to the point where they've wanted to self-delete because this is YouTube. And so it is something that you need to consider. Some of the safer techniques are things like using extenders or pumps, whereas there's some other risky techniques which I'm sure we'll get back to. There's a wide spectrum of injuries, and so you have some kind of cosmetic things like lymphatic channel swelling, discoloration, the little red dots called petechia that can come up from using a pump.
Donut.
The donut edema, exactly. Or you can have more serious injuries like nerve damage and hard flaccid syndrome. And,
will you talk about what hard flaccid is?
Yeah, so hard flaccid syndrome, it's literally not just one diagnosis. It's a constellation of syndromes and a constellation of symptoms rather, but it typically includes like a small, hard, retracted penis. And so it's like your penis is flaccid, but also like in a small erect state. But it's a combination of typically pelvic floor damage, potentially nerve damage, and oftentimes in the literature, it's caused by trauma to the base of an erect penis. And so it actually doesn't just occur from penis enlargement techniques. Believe it or not, there are a lot of guys that can get it from over-aggressive sex and even masturbation.
And if someone is struggling with hard flaccid, is that something that they can heal from, or is that something that they deal with for the rest of their lives?
Yeah, so you can actually heal from it for sure. You just need to, number one, you need to see a true medical doctor. I do coaching. I have like a hard flaccid course myself, but you need to be diagnosed by a urologist and have an appropriate workup with ultrasounds and potentially things like even MRI, CT scans of the spine, because some people don't even realize it, but they have like a disc abnormality that's triggered it. But it is absolutely something that you can heal from.
I mean, a lot of guys end up going to see a physician or get a checkup or have their, a cardiovascular system or see if they're diabetic because they stop seeing their penis performing the way that they want it to, right?
Absolutely.
And that's like, I've talked to guys who haven't been to get a checkup in a decade, but then they, start waking up without an erection, or they stop being able to get an erection when they're masturbating or when they're with a partner. And like finally then and only then do they go and figure out what's going on with their body. Unfortunately, fortunately on one hand, right? Like, but better to prevent than to treat after it's already occurred.
Yeah. Unfortunately, a lot of even doctors don't even know about hard flaccid syndrome. So these guys are doing enlargement. They develop these hard flaccid symptoms. They go to see a doctor, and the doctor typically says, here's some Viagra, here's some Cialis, you're fine. And, call me if you need me.
Right.
And so a lot of people don't get the help they need.
I mean, Viagra is sort of like the hammer. And when all you have is a hammer, everything is a nail, right? And I think that that's true for performance anxiety. That's true for premature ejaculation. That's true for hard flaccid. That's true for small penis syndrome. They're like, here's the one pill that I associate with male sexual performance. Good luck.
Yep.
Right?
Yeah.
So in your experience, what are the shortcuts that guys try to take in order to gain size or gain girth, as opposed to doing the proper techniques, which we'll talk about in a minute?
The thing about penis enlargement, and you've alluded to this before, is that it takes time and it takes dedication. And so there's a lot of compare and contrast when it comes to bodybuilding. But typically, I tell people that over the course of a year, if you're consistent doing roughly an hour to 2 hours per day, that you should expect to gain somewhere around a 1/2 inch in length and a 1/4 inch in girth. And so I also try to tell people that if those gains are not worth it to you, then I don't think penis enlargement is worth it in general, and especially not worth the risk, because you do have to be consistent. And so a lot of guys want shortcuts like heaven forbid surgery. And even things like penile fillers. And I do think that they don't fully understand the implication with those types of...
Right, like when you say filler, we're talking about like fat grafts, the hyaluronic acid. Like I have had clients come to me who said that they did the fat graft and then they didn't necessarily do the aftercare correctly. And now they have like a kind of a lump.
Quasimodo D is what I call it.
Quasimodo D. Yep. Yeah. You said it all right there. Or the hyaluronic acid filler, which from my understanding, it can work. I mean, I put hyaluronic acid, I take it in pill form, I put it in my skin, but it's not a permanent solution. Doesn't the body metabolize it eventually and it's gone?
Yeah. So I'm glad you brought up, because like fillers in general are on the safer spectrum of penis enlargement. But the key thing is that they're not going to do anything for erect length. So they can help with flaccid length and erect and flaccid girth primarily. You mentioned the fat grafting, or basically injecting fat. Okay. There are literally published case reports of men who have died because the fat was injected and it accidentally went into some of the vessels, went to their heart and stopped their heart. It's called a fat embolism. Okay, it's kind of like when women die from BBLs.
From BBLs, from like back alley BBL surgery, right?
Exactly.
It's not worth it.
Yeah, there's been several papers that have been published about injecting silicone into the penis, and there's a diagnosis called siliconosis of the penis that either has to be surgically removed. You can have infections. I've seen people that have just a poor distribution of either the fat or hyaluronic acid. They actually have to inject something called hyaluronidase or surgically remove it to break up the
enzyme that will
lumps.
break down it. Interesting.
Yeah. And especially with hyaluronic acid, it is a temporary thing, and so you would have to keep getting it repeated.
Right.
And
I don't know like how much you love needles to the dick, but like it's not a long-term solution. It's not a cheap solution. It's not an easy solution. It's not 100% or anywhere near that workable solution, and it may lead to disfiguration. And it's not what again, like that's not what we're going for here, right?
Yeah. And even the distribution. So it's typically injected into the skin along the shaft, okay? Right. And so what you end up sometimes is if you get a bunch of filler, it can almost look like your dick is wearing shoulder pads, because the bottom is so broad, but they typically don't inject hyaluronic acid into the head. And so the actual head of the penis stays the same size. And so it can look very awkward sometimes.
Your penis looks like a quarterback.
It can. But that's why I think some of these other techniques, like using an extender or using a pump, because you've alluded to this as well, but using a pump can help with other things, like benefits you as far as erection quality and helping draw in, the healthy blood into the penis, and it can actually make your penis bigger permanently.
So let's talk about those, because this is what I have always recommended to my clients that were interested in penis enlargement. And I recently made a course on penis enlargement, and it's focused just on these proven methods that actually have been demonstrated to work. But as you alluded to, and we're going to talk about more in a second, like they take a high degree of commitment to work,
Absolutely.
right? Like, you know, you can show up at a doctor and you can show up at a back alley doctor and pay cash and get something injected into your body. But like if you commit to using pumps and extenders, you can actually see a difference over time.
Absolutely.
Why is it that pumps and extenders are safer than say like injections or surgeries?
Yeah. So once again, like hyaluronic acid is kind of the only thing that I think is reasonable to do. So you just struggle with girth. That's the only thing you're insecure about. Maybe you want an extra bulge in your, bikini, whatnot. I think that's reasonable. But the main thing with surgeries, and I can't say this enough, is that there are no surgeries that are going to increase the size of your erect penis or the length, of your erect penis. And so let's take a common one, suspensory ligament surgery. So number one, there's a nerve artery and vein that actually run through the suspensory ligament. That can be damaged. There are plenty of men that get permanent nerve damage from having that surgery.
And then if you get nerve damage, you're not feeling, you may not be able to get erect.
And you can't even get hard.
Yep.
Yes. And so, but that surgery has only been proven to increase the appearance of a larger flaccid penis.
And it also causes your penis to hang down further because the suspensory ligament is what holds it up.
Yes. And the suspensory ligament is what stabilizes your penis. So you actually put yourself at a higher risk of what we call a penile fracture. Because
it's not based anymore in the same way that it was before. Yeah. So you're at high risk there.
D pops out, woman comes down on it, boom, penile fracture because it's less stable.
Right. Like, is that risk worth it to you? Okay. So that's why this needs to. Also, I actually got to meet with people that, out of a university in Ohio, that specialize in penis implants recently. And they could not emphasize enough that they can only implant you with something that is as large as what they are removing.
Yep.
So like whatever tissue you have, the size of your tissue, they take that out, they put an implant in. It has to be the same size.
Yep.
Your body can't just like stretch overnight. You can't get a larger penis by having a penis implant. You can get reliable erections. You can either have a penis that like has a little metal rod in it and you can face it up and down, or one where you inflate it with this little pump in the testicles. But those are the entirety of your options, and they only come in a few sizes anyway.
Yep.
So like that's not an option. The things that make pumps and extenders safe is putting the body under traction and under pressure over time, right?
Gradually.
It very slowly causes, on a cellular level, shifts that create actual change. Can you like very briefly describe what's actually going on